Today we discuss how health communication contribute to improving the public's health through public education campaigns that create awareness, alter the social climate, change attitudes, and motivate individuals to adopt recommended behaviors. Campaigns have relied on mass communication, such as public service announcements on billboards, radio, and television, and in the form of printed educational material such as pamphlets and fact sheets. Other campaigns have integrated mass media with community based programs. Health communication supports community centered prevention, which shifts attention from individual to group level change and emphasizes the ability of these and the individuals comprising those communities to effect change on multiple levels. Health promotion activities take advantage of digital technologies such as the World Wide Web to target audience, tailor messages, and engage people in interactive, ongoing exchanges about health. Individual health communication determines a relation between patients and health professionals, affects exposure to and use of health information, and influences the adherence to clinical recommendations. In terms of communities, health communication shape the construction of public health messages and campaigns and the dissemination of population risk communication messages. Health communication in the community can be used to influence the public health agenda, advocate for policies and programs, promote desirable changes in the socio-economic and physical environment, and encourage the social norms that benefit health and quality of life. What is social marketing? Might be its new concept for you. Many health campaigns have turned to social marketing techniques to effect change. The term social marketing describes the application and adaptation of commercial marketing concepts to the design, implementation, and control of programs designed to increase the acceptability of a social idea or bring about behavior change to improve the welfare of targeted individuals or their society. It is marketing for societal benefits rather than commercial profit. At the heart of the health promotion is the need to influence consumers, program developers, policy makers, and others. Our ability to change people's lifestyle through improved diets and increased physical activity is intimately connected to our ability to influence behavior, supporting good nutrition. Communities and communications expert posit a conceptual framework for approaching public health and social behavior, a continuum of options through which to pursue the goals of population based behavior change. This framework assumes that a recommended behavior is a freely available option, an assumption that is only partially true as of, for example, in the case of access to fresh fruits and vegetables and other healthy foods or to opportunities for physical activity. A strong communication program will both target a specific audience with our prevention messages and increase the general public's awareness of prevention-related issues. Raising public awareness can also frequently result in a change in social policies and practices. Effective social marketing and communication can increase the knowledge, influence attitudes, show benefits of behavior change, reinforce the desired knowledge, attitudes, and behavior, demonstrate skills, increase demand for services, refute myths and misconceptions, and influence norms. Every year, new public health mass media campaigns attempting to change health behavior and improve the health outcomes are launched. These campaigns enter a crowded media arena flooded with messages from competing sources. Public health practitioners must not only capture the attention of the public amid this competition but also motivate communities to change entrenched health behaviors or initiate habits that may be new or difficult. The public health approach to prevention acknowledges that problems arise through the interaction of a host, an agenda, and the environment. Prevention programs that focus exclusively on the host may overlook influences in the environment or community, such as advertisement for the foods of high energy but low nutritional value, which promote the nutrition related problems including obesity, type 2 diabetes, heart disease, osteoporosis, and eating disorders. Effective programs take a comprehensive ecological approach, addressing not only individual risk factors but also community norms, local policies, the built environment, mass media, and other factors. Every social marketing campaign starts with an extensive formative evaluation process that includes focus group. Focus group is a gathering of individuals who have been chosen as representatives of a target audience to discuss a specific topic, usually for several hours and in great detail. A focus group generally consists of 6 to 12 participants, with the focus provided by a trained moderator. A focus group study is often used in the development of product concepts or in the first phase of an exploratory investigation of a problem. Qualitative data collected in focus groups provided in-depth information necessary to understand attitude and motivations that influence consumers' decision and behavior. Focus groups give participants an opportunity to describe their experiences and preferences without the limitation of present response categories. The fundamental elements of every social marketing program, examples of which are the product being promoted, its price to the target audience, the strategy to promote the product, and the place or channel through which the product is communicated to the intended audience. These factors, which is product, price, promotion, and place, are also referred to as the 4 Ps of social marketing. Additional Ps included in the social marketing mix are the public or intended audience for the product promotion, partners or alliances in the campaign, purse strings or budget, and policy and politics, or the rules, system, and environmental change factor that influence voluntary behavior change, not policies that punish undesired behavior. An ecological approach assumes that an individual's health is shaped by multiple interacting environmental subsystems, including family, community, workspace, cultural beliefs and traditions, economics, the physical world, and the web of social relationships. Health promotion efforts should be comprehensive, addressing those systems that adversely affect the person's capacity for living a healthy life. And the content, tone, and execution of a campaign is determined by formative research, which includes reviews of existing and new research, discussions with expert consultants who conducted similar projects in non-governmental and state, local and national organizations, and primary audience research with a small group of representatives from the target audience in order to understand their interest, attributes and need. Formative research occurs before a program is designed and implemented. It can help define and understand target population, help in the creation of programs that are specific to the needs of the target population, ensures that programs and materials are acceptable and feasible to the clients before launching the program, and even improve relationships between clients and agencies. Formative research should be an integral part of developing programs or adapting programs. Product is the first P of social marketing. Product is the knowledge, attitudes, or behaviors social marketers want the target audience to adopt. In addition to a desired behavior change, such as drinking low-fat milk, the product may be an actual commodity, such as flavored low-fat milk varieties. A continuum of products exist, ranging from tangible, physical products, which is low-fat milk, to service, a nutrition education module that promotes low-fat milk, and to practice, which is eating low-fat dairy products. The social marketing product may also be a policy, a regulation addressing the types of milk served in a school district. Other examples of social marketing products include breastfeeding and physical activity. Project promotes breastfeeding as a means towards mother-child bonding rather than as a way to confer passive immunity on the infant. Whenever the marketer must develop an enriching package with which it is associated. A viable product helps the target audience first understand that they have a genuine problem and then recognize the product being offered as a good solution to the problem. One role of social market research is to discover the audience perception of the problem and the product and to determine how important they feel it is to resolve the problem. In the commercial exchanges where consumers receives a product or service in exchange for a cash outlay, public health markets rarely exchange an immediate, explicit payback for adoption of healthy behavior. Social marketers distinguish between the core product and the actual product. Core product means what people will gain when they perform the behavior, and the actual product is the desired behavior. To succeed, the product must provide a solution to problems consumers consider important or that offer them a benefit they truly value. For this reason, social marketers conduct research to help them understand the target audience aspirations, preferences, and other desires to identify the benefits most appealing to the consumers. The marketing objective is to discover which benefits have the greatest appeal to the target audience and design a product that provides those benefits. Public health professionals must change their recommendations or modify their programs to provide the benefits that consumers value, according to the case. Price describes what the consumer must do or pay to obtain the social marketing product. Specifically, it refers to the money, intangibles such as time, effort, social approval, lost opportunities, or embarrassment involved in a person's changing behavior. In social marketing, price might be the perceived cost of giving up the rich taste of whole milk or the discomfort associated with behaving differently from one's peer. If the cost outweigh the benefits for an individual, the perceived value of the offering will be low, and it is unlikely that it will be adopted. If the benefits are perceived as greater than their cost, the chance of trial and adopted of the product is much greater. Price represents a balance of the product's benefit with its cost to members of the target audience. To reduce the perceived cost of behavior change and make the change easy to adopt, social marketers recommend removing social and environmental obstacles. Enacting policy change can help address these barriers by minimizing the price the target audience believes it must pay in the exchange. There are many issues to consider in setting the price. If the product is priced too low or provided free of charge, the consumers may perceive it as being low in quality. If the price is too high, some will be unable to afford it. Social marketers must balance these considerations while also conforming a sense of dignity on the transaction. Perceptions of cost and benefits can be determined through research and used in positioning the product. This is the third P of social marketing. Place is where the target audience either performs the desired behavior or accesses the programs and services. Place also describes how the product reaches the intended audience. For a tangible product, place is the distribution system, including the warehouse, trucks, sale forces, and retail outlets where it is sold, or location where it is distributed for free. For an intangible product, place is less clear cut but refers to the channels through which consumers are provided with information or training. These may include doctors, offices, shopping malls, mass media outlets, schools, house of worship, or in home demonstrations. Place affects price. If the message to drink more low fat milk is promoted through the school lunch program, the price of peer pressure may be reduced. The exchange and its opportunity should be made available in place that reach the audience and fit its lifestyle. Another consideration of place is deciding how to ensure accessibility of the offering and quality of the service delivery. by determining the activities and habits of the target audience as well as their experience and satisfaction with the present delivery system. Researchers can pinpoint the most ideal means of distribution for the offering, such as where the behavior should or should not occur, or what barriers or opportunities exist for the behavior's occurrence. Place should be readily available. To ease access, social marketers should be prepared to move programs or products to place the intended audience frequently. Promotion is the fourth P of social marketing. Because of its visibility, promotion is mistakenly assumed to comprise the whole of social marketing. It is only one component. Promotion focuses on creating and sustaining demand for a product through the integrated use of advertising, public relations, media advocacy, personal selling, and entertainment vehicles to convince the target audience that the product is worth its price. It may include publicity campaigns through the mass media, such as news stories and advertisement on television, radio, and newspapers, public service advertisements and paid advertising, coupons, editorials, food demonstrations, and taste tests at a variety of community sites, and supermarket shelf labeling initiatives to draw attention to the program's messages. Research is crucial to determine the most effective and efficient vehicles to reach the target audience and increase demand. Research helps determine the communications that should occur, from what sources to whom, and through what channels of influence. For example, the exchange should be promoted creatively and through the channels and tactics that minimizes the desired responses. Promotion includes multiple ways to reach the target audience to advocate the benefits of the behavior change, including product, price, and place components. Some of the promotion strategies and tactics are employed by the campaigns include paid media advertising, community-based events, contests and sweepstakes, community and corporate partnership and websites. To be successful, the programs social marketers promote must often reach multiple audiences. These publics include external and internal groups involved in or affected by the program. External public encompasses the target audience as well as secondary and tertiary audience, policymakers and gatekeepers. The primary audience might be children ages 9 through 13, with a secondary audience of the people who influence their decisions, such as parents, teachers, imams of mosque, and physicians, and a tertiary audience of policymakers and directors at local radio stations. Internal publics encompass those involved in some capacity with approval or implementation of the program, such as board of directors and staff of office. Social marketing program can inspire individuals' behavior change, but sustaining that change is difficult unless it is supported in the long run by environmental components. Policy change is needed to bring about lasting behavior change. Policy efforts of the 1% or less campaign might focus on increasing milk choices available in the school cafeterias to include low-fat, fat-free, and low-fat flavored milk in addition to the whole milk. Campaign might focus on increasing the number of bicycle paths in a community and increases the availability of after-school programs that appeal to the targeted age group. Health issues are often so complex that one agency cannot make a dent by itself. Partnership or alliances should be cultivated with local or national groups, corporate sponsors, medical organizations, service clubs, or media outlets that have goals similar to those of the social marketing campaigns. Partnerships can increase the likelihood for success by creating buy-in throughout the community, enhancing credibility of the program through connections with well-known partners, increasing available financial and human resources, and gaining access to a greater area of the expertise in health. Strategic alliances offer many important benefits to the social organization, including improved delivery of their messages, heightened influences, and broader reach. There are risks involved in the strategic alliance process, such as conflict of interest. Consider these guidelines when contemplating work with for-profit partners, which include carefully review each partnership proposal and do not enter into any collaboration that endorses a specific commercial product, service, or enterprise. Only allow your program's logo to be used in conjunction with approved projects and only with your written permission. Retain the right to review all copies such as advertising or publicity prior to the partners using your program's name or logo. Prior to the partnership negotiations, confirm that a partnership with this company will not create tensions or conflicts with another partners for your program. Ensure that the company has no unresolved disputes with or is not currently in negotiating for a grant or contract from your organization. That it conforms to standards of health, medical care, and labor practices, and that its products, service, or promotional messages do not conflict with your organization's policies or programs. Purse string is the funding component of strategy development. Most organizations that develop social marketing programs operate with funds provided by foundations, government grants, or donations. When planning and allocating fund, consider how long the funding will last, how strategic partnership can foster more resources, and whether products or services must be offered for a cost. A social marketing campaign consists of six stages: planning the approach, defining the program's messages and channels, developing and pre-testing program material, implementing the program, evaluating the program, and using feedback to refine the program. Each of these components of a health communication campaign can be viewed as a self-contained project of its own and are further defined. Planning establishes the foundation for the entire program. Before moving ahead, an assessment of the program is undertaken and available resources are identified. During this stage, the target audience is identified and should become increasingly segmented. For example, into groups with common risk behaviors, motivations, or information channel preferences to aid in developing appropriate messages. Goals and objectives are developed during planning. Formative evaluation also begins during the planning stage and continues through the development of materials to be used in the program. During the planning stage, always perform literature review. This defines the scope of the problem and identifies the type of problems and types of programs that have developed to address the situation. And always define the audience, which is a social marketing program may need to address more than one audience to accomplish its objects. Planners often differentiate among primary, secondary, and tertiary audiences to pinpoint whom they are trying to reach. The primary audience is the specific group or groups the program is designed to influence. Even small, apparently homogeneous communities contain various subgroups within their population. Personal, environmental, and geographic differences can help define subgroups. Personal factors include age, gender, ethnicity, and cultural background, socioeconomic level, literacy or educational level, occupation or gang membership. Environmental factors include stress, social support, access and barriers, and exposure to harmful agents. The geographic area is where people live. A primary audience may consist of one subgroup, which is adolescent males, or a combination of groups, which is adolescent males and their parents. A secondary audience includes individuals who influence the primary audience, such as peers, parents, teachers, and role models. The tertiary audience comprises community decision makers who influence the policy and offer financial and logistical support to community-based prevention programs. The support of this group is critical to any prevention program. These individuals may actually comprise the primary audience in some social marketing programs. And third step is the analyzing the community. A community analysis helps identify its driving and restraining forces. Your action plan should build on the driving forces and diminish the restraining forces to strengthen a community's prevention effort. Social asset mapping creates an in-depth understanding of a community by identifying local resources, networks, place of importance, prevalent issues, current connections, and where potential new connections might be made, such as underlying creates numerous possibilities for new and innovative approaches to community empowerment that are compatible with maintaining the healthy environment. And always develop the concept. State the issue or broad goal the campaigns is trying to address, for example, to promote the physical activity. Always set goals and objectives. Determine what you are trying to achieve and what behaviors would have the greater differences. State the desired attributes and expected benefits of each targeted behaviors. For example, for physical activity, the desired attributes and anticipated benefits might include burning fat to lose weight, look better, producing the endorphins to reduce the stress and feel more energy, and building muscle strength to become stronger and more independent in daily activities. Always identifying core components or strategies. This include decide, deciding how to communicate, challenging messages about the desired behaviors, making the desired behaviors more rewarding or attractive, making the desired behaviors easy to achieve or of lower cost, improving people abilities to adopt the behavior change and decreasing the attractiveness of competing behaviors. And always outline your basic principles. The principles of a social marketing campaign include product, price, public, place, promotion, policies, and the development of a budget. The second step in a social marketing campaign is to identify the messages to be delivered and choose the appropriate and effective channels of communications. It is also important to identify the environment, situations, or settings in which the targeted behaviors should not occur, such as schools, homes, parks, or other public places. Typical communication channels include television, radio, newspaper, and other print media, and bulletin boards in markets, neighborhood centers, mosques, and other places where people congregate. Using the multiple channels ensures greater coverage of the issues and improved chances of reaching the target population. A multiple outlet or a limited outlet approach may be used. A multiple outlet approach uses as many available resources as possible, including television and radio stations, newspaper and billboards. The community is inundated with information from these outlets. A limited outlet approach concentrates a significant commitment of time and resources on one or two outlets only, resulting in a campaign that becomes very closely tied to the chosen outlet. When choosing communications channel, consider the channel's credibility, cost, reach, and the average number of the times an audience is exposed to the message. The message of the program sends must be meaningful and appealing to the target audience. An effective message stimulates the target audience to think about and discuss the issues. The message should be based on facts and tied to the present because value instant gratification. The campaign should develop and convey the clear, concrete suggestions and model alternative behavior or ways of doing things without resorting to scare tactics and negativism. The program's ultimate outcome should be to establish social norms that promote and sustain the healthy, safe behavior. The message should minimize the psychological or physical cost of the product to the target audience. For example, if an adolescent assumes that drinking low fat milk will lower his or her status among peers, the message might minimize this cost by highlighting the popular celebrities who drink milk. Develop a draft of all marketing material for presenting with an audience similar to or a subset of young target audience. Ask this group if these materials produce the intended results. Revise them based on their criticism and suggestions. Repeat this process until all stakeholders are satisfied with the end product. A focus group can greatly facilitate the process of preparing materials that appeal to your audience. Logic models are developed for public health programs and campaign. A logic model links campaign input and activities with campaign outcomes. It describes the sequence of events for bringing about behavior change and presents the relationship between campaign inputs, campaign activities, the impact on output and outcome. A logic model can be used as a tool to identify the short-term, intermediate, and long-term outcomes for the campaign, link those outcomes to each other, and to campaign activities. Select outcomes to measure depending on the stage of the campaign's development. Demonstrate how it may take time before long-term outcomes can be associated with the campaign. Before launching the campaign, All communication materials should be ready and available in sufficient quantities. A method to track and evaluate the program must also be in place. Tracking allows the program planner to determine where the program is succeeding and identifying areas where changes are needed. The most successful programs are constantly being updated with current information about the program and the target audience. The process evaluation, which essentially reviews those tasks involved in implementing the program, is appropriate for use during the implementation phase of the program. Assessing a program's effectiveness goes beyond the process evaluation of the planning, defining, and development stages of a campaign. Program evaluation measures if and how much the program affects belief, attitudes, and behaviors of the target audience. While outcome and impact evaluation should be designed during the planning stage, it is not conducted until the evaluation stage. When designing a program evaluation, include key questions such as what are our success indicators and how will we know if we have achieved them. The type of evaluation conducted depends upon several factors, including money, time, policies affecting the ability to gather information, the level of support for evaluation, and the overall design of the program. Outcome evaluation is used to gather descriptive information about knowledge and attitude changes, expressed intentions of the target audience, and the initiation of policy changes. Impact evaluation, the most comprehensive evaluation, focuses on the long-term outcomes of the program. It measures factors such as changes in morbidity and mortality, long-term maintenance of the behavior change, and changes in abstinence from work or school. Impact evaluation is most used in multifaceted health education programs that include awareness, education, training, and communication components. The evaluation should involve all stakeholders, including members of the target audience, program implementation, and grant makers. It must identify indicators of success, document evidence of success, and determines how the overall campaign can be improved. Use evaluation feedback to make adjustment in campaign component as needed. If no change in behavior is seen with a particular subgroup, modify components or intensify exposure to them. Always be sure to celebrate successes. Group celebrations of accomplishment, such as successfully establishing a supportive policy change, help maintain morale and enthusiasm for the program. Focus attention on improvements in desired behavior and outcomes and honor the individuals who have contributed to those improvements. This may be a simple awards ceremony to acknowledge community champions. Strategies to sustain the effort long enough to make a difference are vital. These might include using the process's evaluation information to help secure sustained support from grant market and other funding sources, securing the media coverages of all the issues or goals and successful implementation of relevant components. Hold a news conference and pitch features stories as part of our media advocacy to promote continued awareness and enhance public support for attempts to address it. Promotion, adoption of effective campaign components, or advocating for changes that contribute to improvement. Promoting ongoing implementation through collaborating partners. Digital marketers must pay careful attention to ethical standards and practices. If the field is to mature as a profession, most social marketing and health communications projects give rise to ethical dilemmas related to either the ends being pursued or the strategies and tactics used to achieve them. During the course of a project, issues might be raised by managers, colleagues, audience members, community groups, partners, media, or opponents to the cause. During the planning stages, one might ask if the goal of the program are truly in the public's interest and whether the primary beneficiaries of the program are the targeted groups and subgroups, not the change agents. Social alliances, in other words, partnerships between for-profit and non-profit organizations, can present ethical challenges for one or both partners. It is thus incumbent upon both companies and non-profit to give the considerable attention to develop ethical standards and procedures for addressing ethical issues when they arise. During the evaluation phase, one might want to determine if the strategies and components of the program were implemented responsibly, if potential negative side effects were avoided or minimized, and if the benefits of the program outweighed the risk. In the last 30 years, the prevalence of obesity has seen a rapid rise that shows little sign of abating. More than 50% are obese and overweight. Because of the strong correlation between overweight and the risk factors for morbidity and mortality, confronting the obesity epidemic in an urgent public health priority. Overweight and obesity are defined in relation to the body mass index, which is weight in kilograms divided by the square of height in meters. In adult, a BMI of 25 to 29 is overweight, of 30 to 39 is obese, and over 40 is extremely obese. Children are considered at risk of being overweight if their BMI is between the 85th and 95th percentile for age and gender, and are overweight with a BMI above the 95th percentile. Overweight and obesity are known risk factors for cardiovascular disease, diabetes, metabolic syndrome, high blood pressure, high cholesterol level, asthma, arthritis, and poor health status, as well as physiological ailments such as orthopedic abnormalities and premature menarche. This is your DISC Go Guide. It is designed to help you learn about good nutrition and how to select foods with less saturated fat and cholesterol. These foods are Go foods. Each day, select the recommended variety of Go foods from each food group on the circle. Select Go foods from the center of the circle and go for them. Use the DISC Go guide to keep yourself going and growing. The foods on the outer edges are whole foods. Eat them less often or eat Go foods instead. DISC will teach you how to eat more Go foods and fewer whole food. Sometimes Go food becomes whole foods if they are prepared with whole ingredients. DISC will teach you how to prepare foods in a Go way. In addition to preventing the disease, nationwide efforts are made to actively promote health through nutrition, beginning with conception. These efforts provide target audience such as women of childbearing age, nursing mothers, and low-income individuals with the supportive environment needed to make healthy choices that will circumvent the onset of disease. As seen by the programs, environment can be interpreted to mean the nature of the food available for purchase, for example, folate fortification, emotional support, financial assistance, or enhanced nutrition knowledge through education and outreach. Studies have shown that folate supplements taken around the time of conception significantly reduce the occurrence of neural tube defects in infants. To lower the risk of neural tube defects, women are advised to consume 400 microgram a day of folate prior to conception and 600 microgram during the first trimester of pregnancy. Only 30% of women of childbearing age consumes sufficient folic acid to prevent spina bifida and anencephaly. Because folic acid alone or in a vitamin supplement has been proven to reduce the risk of an neural tube defects affected pregnancy by 50 to 70%. All refined grain products, bread, cereals, corn meals, flour, pasta, rice are fortified with folate. Folate in fortified foods and supplements is absorbed almost twice as well as folate naturally available in green leafy vegetables, citrus fruits, legumes, and whole grain breads. Half of all the pregnancies are unplanned. Campaign targets all the women of childbearing age, both those who are thinking about becoming pregnant and those who are not planning a pregnancy now or in the future. The campaign goals are to increase the awareness of the need for women who can become pregnant to consume folic acid every day, increase the knowledge that folic acid taken daily before and during the early pregnancy can prevent some serious birth defects, change behavior of all women who are capable of becoming pregnant to consume 400 micrograms of folic acid daily, educate the influencers of women to conduct the information sessions about folic acid. Policymakers also need to be influenced to include folic acid in programs. The campaign provides free educational materials to concerned organizations including radio public service announcement scripts, posters, and downloadable fact sheets. Researchers confirms that breast milk is the best food for a baby's first year of life. Breastfeeding provides many health, nutritional, economical, and emotional benefits to both mother and child. The breastfeeding promotion projects offer the mothers choosing to breastfeed are provided information through counseling and breastfeeding educational materials. Breastfeeding mothers receive follow-up support through peer counselors. Breastfeeding mothers are eligible to participate longer than non-breastfeeding women. Mothers who exclusively breastfeed their infants receive an enhanced food packages. Breastfeeding mothers can receive breast pumps, breast shells, or nursing supplements to support the initiation or continuation of the breastfeeding. Tailored health communication has emerged as a promising, innovating approach to addressing the public health issues. Any combination of information and behavior change strategies intended to reach one specific person based on characteristics that are unique to that person, related to the outcome of interest, and derived from an individual assessment. Tailored communications are created especially for an individual based on knowledge of that person. This information may be gathered through a survey or a brief personal interview with a professional. The result of these questions are entered into a computer which draws from a library of possible messages to create material that directly address the individual's need, interest, or concern. Once a program has been developed for a certain health issues, it can be used to produce tailored print materials with the potential to reach large population. Tailored communication are a promising and innovative approach that can be used to address a variety of public health issues. A subset of larger field of health communication, tailored communications are distinct from more familiar but less personalized methods of developing targeted material. Messages prepared using information about population segments or personalized materials. A person name draws attention to a generic messages because they can address cognitive and behavioral patterns as well as individuals' demographic characteristics. Tailored materials are more sophisticated than targeted ones. According to the first scientific review of the tailoring research, tailored print communication have demonstrated an enhanced ability to attract notice and readership, are more effective than non-tailored communication for influencing the health behavior change, can be an important adjunct to other intervention components. Empirical research shows that tailored print materials are more effective than non-tailored ones in helping the people change health behaviors, such as physical activity and diet. Although tailored material have not been equally effective for all individuals, tailored weight loss materials are more effective in bringing about more positive thoughts about the material, personal connections to the material, self-assessment thoughts, and thoughts indicating behavioral attention than non-tailored material. The tailoring of health information can significantly improve the chances the information will be considered and can stimulate the pre-behavioral change such as self-assessment and intention.